So my history in terms of my research has been looking at the use of telehealth in various locations, primarily in the US. With COVID-19, we're seeing a huge spike in the use of telehealth. What we found in March 6th, Medicaid and Medicare both came out and enabled people to get additional reimbursement for doing telehealth. So in this area, we're looking to see specifically how telehealth and telemedicine can be utilized in the homeless population to ensure that they get the health care they need during the times of COVID. We've been really excited to continue our partnership with Pine Street Inn, St. Francis House, and Heading Home to be able to identify ways that we can look at their homeless population and provide them the support they need to obtain health care that they need. Next up with this is we've just begun a partnership with Samaritan and Primary Care Innovation Lab at the University of Washington. In this project, Samaritan is providing technologies that enable the homeless population to receive funds and use those funds for things such as food and healthcare. Our particular focus is how we can make partnerships with healthcare providers that will take these funds and use them as their payment for healthcare when the homeless population wouldn't necessarily be able to have access to enough funds to get the healthcare they need. So we have some great projects coming up. So I continue to work with my core project team, which is Sandeep Perot in IPM and Haijing Hao in CIS. We do primarily data analytics and process modeling, working with the homeless community, but we're also really concerned about how the digital divide is impacting the use of technologies by these people. The group that we work with there is Tech Goes Home, and they've been looking at ways to expand their outreach to the community to include not only children that are having to do distance learning, but also those that are underhoused or homeless at places like the Project Place, where they'll go in and help teach people how to use the technologies so they can make those connections that are so important for them to find jobs and get the education they need. So I've been interested in a long time on how I can use my skills in technologies to be able to help society better. And luckily for me, I've done a lot of work in healthcare, and I'm part of the Bentley Health TLN, and they had some grants available for us that for people that were looking to apply our research into new areas. We were fortunate enough to get one of those grants, and with that, we started these partnerships with primarily Pine Street Inn. We now have at least 2 publications in different technology outlets, and this started us down this path.